Andrew, thank you very much for inviting me to speak. I'm going to start by asking you all to think about a question. How can we possibly know that another human being is conscious and aware? And when I ask you that question, I'm not trying to dig any deep philosophical holes about consciousness. I'm asking a really practical, down-to-earth question. How could I know that any one of you, any member of the audience, is conscious and aware? And the answer is, unless you are willing and able to tell me, it's exceedingly difficult. A much easier question to answer is whether any of you are awake. And wakefulness and awareness are two different components of consciousness. And the reason that wakefulness is easier to assess is because you can do it just by looking at somebody. So I can look at you, sir, your eyes are open, and it's a pretty good bet that you are awake. If I wanted to get all scientific about it, I could put an EEG cap on your head, and I could look for the characteristic electrical signals that we know are associated with a normal wakeful state. And on that basis, I could conclude with 100% reliability that you are awake. But awareness, unfortunately, isn't like that. I can't just look at any one of you and know that you're aware. You could have your eyes open, but as the old saying goes, the lights could be on, but there could be nobody at home. I can't even put an EEG cap on your head and, in a resting state, know that you're actually aware. So how am I going to solve this tricky problem? Well, what I would do, in fact, the only thing I can do, is to ask you to tell me if you're consciously aware. And I'm going to do this now to demonstrate this idea. So I'm going to ask you to raise your left arm high into the air if you're conscious. Please raise your left arm if you're conscious. That's a relief. Good. Right, now I'm a scientist and I like to repeat experiments, and it could be in some sort of cosmic coincidence that you all just happened to raise your arm at that moment. So we need to do it again just to check. So please all raise your left arm if you're conscious. Excellent. Right, this is fun. Now, I'm going to make it a little bit tricky. I'm going to change things. Listen carefully. Please raise your right arm if you're conscious. Excellent. Good. Thank you. Right, that's that over with. We can move on with the talk. Now, what you've done there is what we call command following. And command following has allowed me to know for sure that you're all conscious. I issued a command, raise one or other arm. You performed an action in response to that command. That's command following. That's how we know that you are aware. And really, it's the only way of being absolutely sure that somebody is aware. Now, if there are any philosophers in the audience, you're probably getting a little bit uncomfortable with this already, and you're thinking, well, you know, I could program a robot to raise an arm when I told it to raise an arm and raise the other arm and so on. But I'm not talking about machines here or robots. We're talking about human beings. And the question is not, can we program a machine to give the impression that it's aware? The question is a human who is able to raise the right or left arm according to command aware? And the answer is yes. That is command following, and that's the only way we have for knowing that somebody is truly aware. Indeed, most of you will have probably seen an episode of ER or House, and the doctor takes the patient's hand and says, move your hand if you can hear me. They're looking for evidence of command following. Now, I don't really need to do that with you because there's plenty of evidence that you're aware. The very fact that you're here at all today tells me that. But what do we do with patients that we don't have any other circumstantial evidence for? And the vegetative state is exactly that sort of problem. Now, many of you will be familiar with this patient. I'm not using this example because I want to convince you that she either was or wasn't aware. I'm using it simply because this video is widely available on the internet. I can show it to you without invading anybody's privacy. So this is a very typical vegetative patient. And the vegetative state is often referred to as a state of wakefulness without awareness. And that is because these patients will open their eyes. They'll have what we call sleeping and waking cycles. They'll wake up and they'll fall asleep. They'll even appear to look around the room, although they won't ever look at anything in particular. So they behave in a way, in the sense that they're animate, but they do not actually interact in any way with the outside environment. In fact, it's impossible to elicit any responses from them. So there's no responses. That's the real hallmark of the vegetative state, behavior without responses. Now, think about the two things that I've told you. In order for any of us, even those of us who are walking and talking, to convince somebody else that we are conscious, we have to respond, right? That was point one. Point two, vegetative patients are incapable of making responses. Therefore, we have a little bit of a logical problem here. If a patient was conscious, if one of these patients was actually conscious but was incapable of generating any responses, we would logically have no way of knowing that that person was conscious. It's a logical certainty. This is the problem we've been trying to tackle in Cambridge for the last 10 years or so, and we've been using a type of brain imaging. Specifically, it's called functional magnetic resonance imaging, or fMRI. The point is to put the patient in the scanner and then try, on the basis of the brain activity that we see, to establish whether they are or they are not conscious. Now, fMRI is a very powerful technique. We can get very good structural images of the brain. Here's one here. This is a real person. This is not a cartoon. It's a real reconstructed three-dimensional image of the human brain. And we can also look at activity when people are either exposed to certain stimuli or they imagine things. And that's the key to the types of studies that we've been doing. We've been using an interesting effect in the brain, which is that if you imagine something, the same areas of the brain will activate as though you were actually doing that thing. And the example we use most often is to imagine playing tennis. Now, if you imagine playing a game of tennis, what you will see is an area of activity across here. This is the premotor cortex. It's on top and towards the front of the brain. This happens in absolutely everybody when they imagine playing tennis. Now, it's not because we've all got a tennis part of our brain. It would have worked with squash or swimming. All that is required is that the person imagines doing something like that. You can see I'm not a very good tennis player. So the point is just to get the person to think about moving their arms. And when you think about moving your arms, you get activity in this area of the brain, which we know is responsible for initiating movement. And of course, in these instances, we're interested in patients who are incapable of initiating any movements, but we want to see whether we get the brain activity. And when you ask somebody to relax, the opposite happens. This activity in the premotor cortex disappears. Now, this is formally identical to asking you to raise your arm. Essentially, what we're asking somebody to do here is to activate their premotor cortex, and to do that by imagining playing a game of tennis. So the question is, can we use this to detect consciousness in a patient who has no other possibility of moving? And in 2006, we had an improbable breakthrough, I think. We found a patient who was entirely vegetative. She was a young woman who had been involved in a road traffic accident. She had been hit by two cars whilst crossing a road using a mobile phone. And she, for 5 months, had been in a vegetative state. And she, interestingly for us, was the very first patient that we tried this technique on. And the idea was to put her in the scanner and to have her imagine playing tennis. Now, here's what a healthy volunteer looks like. This is now a single slice through the middle of the brain, and this is what we saw in our patient. She activated exactly the same area of the brain as a healthy volunteer, despite outwardly showing no signs at all of being conscious. And this is not something that only happened once. Every time we asked her to imagine playing tennis, this part of her brain would light up. Every time we asked her to relax, the activity would disappear. So we tried a second task. In the same sort of way that I asked you to raise your left hand and then raise your right hand, we came up with a different task that would activate different parts of the brain to see whether she could do different things. And we used something that psychologists call spatial navigation. We asked her to imagine moving from room to room in her house. This activates a whole network of regions in the brain, in particular at the back, the parietal cortex, and an area deep within the brain called the parahippocampal gyrus, and also an area on the side of the premotor cortex. And again, when we asked her to imagine moving from room to room in her house, she activated all three of these regions. In fact, her brain activity was indistinguishable from a healthy volunteer performing the task. And again, same thing. When we asked her to start doing this task, the activity would appear. When we asked her to stop, the activity would disappear. Now, on this basis, we concluded that she wasn't vegetative at all, again, despite any other evidence that she wasn't. And that was because she's command following. She's doing exactly what I asked you to do at the beginning of my talk. In fact, she's doing two things. Rather like raising a left arm, raising a right arm, what she's doing is she's activating her premotor cortex when she's imagining playing tennis, and the other parts of her brain when she's imagining moving from room to room in her house. Now, this was an extremely surprising finding at the time, and of course, we went on to look for other patients to see whether there were other people in this same situation appearing to be vegetative, but nevertheless being able to perform these tasks in the scanner. And over the next few years, of 23 patients that we scanned, 17% were able to perform these tasks. So 17% of patients who appeared to be vegetative were actually conscious and could activate their brain at will. So the question we then asked is, well, can we hone this technique to actually communicate with any of these individuals? Could we turn this into some form of rudimentary communication? And this actually is a rather simple step, and I'll illustrate it here. Basically, all we're doing here is saying, if you want to say yes, imagine that you are playing tennis. Now, here's an example from a healthy volunteer. This is somebody who we scanned who gave me a list of names, Bob, Terry, John, Steve, Harry, and a list of relationships that she had with people, father, son, nephew. And I just had to guess what the relationships were. I had to put the names with the relationships. And here's an example. I said, is your husband called Charlie? What we saw is no activity in the premotor cortex. Remember, all she knows, and there's no training here, all she knows is that she wants to say yes, imagine playing tennis. This is what happened when we said, is your husband called Terry? There's that band of activity. It's not terribly strong, but it's in exactly the right place in the brain. The premotor cortex is activating. And that's because her husband is called Terry, and she's thinking, right, now I've got to imagine playing tennis. She's imagining playing tennis. I see the activity. And while she's still in the scanner, this is all happening in real time, I can say, I think your husband's called Terry. And of course, I was right. Now, some of you, if you're a bit cynical, you might be thinking, well, you know, she loves her husband, and every time she hears his name, she gets a bit wobbly, and that sort of activates the motor regions of the brain. It's all an automatic thing. Well, we know that can't be the case because, of course, we have control conditions. So here's what happened when we said, is your dog called Terry? So it's the same name. If this was just an automatic reaction to the husband's name, then you'd expect to see activity in that to the question, is your dog called Terry? And here's the response to the fourth condition, is your dog called Charlie? The whole of the premotor cortex was activated. Now, I know what you're thinking. But I think we'll leave that to the social psychologists. Now, so we had the technique, we showed that it can work in healthy volunteers, and we now just had to find a patient to try the technique, a proof of concept in a patient. And earlier this year, we came across, this time a young man who again had been involved in a road traffic accident. And he was a really remarkable gentleman. He had been in a vegetative state for 5 years. So for 5 years, he had appeared, despite multiple clinical investigations, to be entirely vegetative. And he came to our notice because when we asked him to imagine playing tennis or to imagine moving from room to room in his house, as we had been asking all of the patients that we see, he produced that characteristic pattern of brain activity in the different areas of his cortex. So we then explained to him that we would like him to imagine playing tennis, to say yes, and then imagine moving from room to room in his house to convey a no. Those were his instructions, and we then asked him a series of questions that we did not know the answers to, but they were concrete biographical questions that we could verify the answers to later, because obviously this was a proof of concept. We couldn't just ask random questions about what he thought about philosophy. We had to make sure that this would really work. So, for example, when we asked him, is your father's name Thomas, this is what we saw. Now, I'm going to try and teach everybody in the room to become a neuroscientist now. Is your father's name Thomas? That's what we saw in his brain at the bottom there. Please raise your arm if you think this patient's father's name is Thomas. Good, well done. Okay. Then we said to him, is your father's name Alexander? So again, we had a list of names and we had a list of relationships. This is what we saw when we asked, is your father's name Alexander? Now, please raise your arm if you think this patient's father's name is Alexander. Amazing, you are all neuroscientists. Yeah, this is not an ambiguous response. This was something that was absolutely clear, and we went through 5 correct answers like this. This patient was able to answer 5 questions in a row by activating either his premotor cortex or the posterior parts of his brain to say yes or no to 5 separate questions. Now, clearly, despite appearing to be vegetative, this patient isn't. This patient is conscious, and he's also able to perform actions. Now, they're not actions in the typical sense of movements of his body or movements of his mouth. These are actions of his brain. He's producing brain actions, and he's able to turn those into responses that we can interpret accurately as answers to questions. Now, I can imagine, and I can sympathize with the fact if you, or some of you may be nervous about using brain activity in order to interpret somebody's questions. But, in his case, there is no alternative. This is all we have. This is his only way of communicating with the outside world. But more than that, I think the important thing is we are just using exactly the same criteria that any of us would use to determine that another human being is consciously aware. If I came down into the audience now and I asked one of you 5 questions, 5 biographical questions about your family, and you responded with 5 answers that I subsequently verified were correct, then I think I would be quite legitimate to conclude that you are a sentient human being and you are thinking and you are aware of your position in the world and what's going on around you. And all we've done is created a situation where this patient has that same opportunity available to him. Now, obviously, just because he can tell us in this particular experiment that his father's name is Alexander, that doesn't tell us what his internal mental state is like. It doesn't tell us whether he's depressed. It doesn't tell us whether he's sad or angry or whether he'd like to live or die. But of course, we now have a mechanism for asking him those questions. And at the end of the day, that's the only way I could find out any of that information about any of you in this audience. I would have to come and ask you, and now we can ask him. Of course, he can only give yes and no answers, and we're working on that to try and improve it. But any of you that have played 20 questions, I'm sure you all have, will know that you can actually get really quite a long way with simple yes and no questions. But I will leave the final word on this to one of our previously vegetative patients. Now, this is a really remarkable woman. Her name is Kate Bainbridge. She was the very first patient that we ever put into a scanner in 1997. We had no idea what we were doing. We put her into the scanner, we showed her pictures of her family and friends, and her brain lit up like a Christmas tree. It was very surprising, and of course we were very excited about it. And she, at the time, had been in a vegetative state for some months. And it was a long time ago. We really didn't know whether we could interpret that in terms of consciousness, whether it meant that we could communicate with her. But just that finding in that patient started a whole series of studies that have led us to where we are today. Kate was also remarkable because she was one of an unusual group of patients who went on to recover. And she's still very severely disabled, but she is very able to write emails to all of us, and she does that very often. She communicates by way of a letterboard. And very fortunately, I think this is a fitting end to my talk, she emailed me 3 weeks ago, and she had been reading the British newspapers, and there was an article about some of the work that we had been doing in the Daily Telegraph. And she sent me this email, which I think sums up our feelings, or her feelings about this work. She said, I saw the article in the Daily Telegraph, and I agree that yes or no questions are the best. I remember a physiotherapist asking me why I was making so much noise in about October 1997. I knew very well why. I was screaming as they put me through so much pain. If she had asked a question I could have answered with a yes or no, I could have explained. I expect she didn't know why I was making so much noise. I think yes or no questions should be used more. They could have shown that I was with it in my mind. Thank you very much for your attention.